Namaste. Welcome to your prenatal asana series. We are going to practice Vayu Nishkasana, or also known as wind releasing pose. This pose is safe to practice in second and third trimesters and should be avoided in the first 12 weeks of the pregnancy, as this is a full squat posture and requires the entire pelvic area to be open. Hence, all the other conditions in which the pelvic area opening should be avoided also applies here, including placenta previa, where the placement of placenta is down, cervical stitch, where the stitch is given to the cervix muscle to avoid premature delivery. Second, breech baby condition, where the baby is after the 36th week also, the baby is upside down, means the head is up and the body is down. So we are trying to position the baby at that point in time after 36th week, and hence we do not want to position the rotated baby in that posture. That's why we won't practice any pelvic opening asana at that point in time, if the condition is known to the woman. Second is, after that is hermoids, where there is hemorrhoids, where the anus bleeding is happening due to excessive or acute constipation. Now, the other conditions can be premature cervix dilation. Now, what is premature cervix dilation? Is when the labor time is coming near, the cervix muscles starts to dilate eventually, so that the opening can happen for the child to come out. But this can happen prematurely also. Prematurely means prior to 38th week. Now, if that is the condition, then also any full squatting asanas should be avoided. Even in the case of preterm labor, where the labor has started prior to 38th week, this asana or any full squatting asana should be avoided. And keeping in mind that this asana is absolutely full squat and we have to slightly stay there in the full squat, so it can be uncomfortable especially for the women who have never practiced squatting much. So in that case also you can avoid it. Other conditions can be excessive pelvic pain, excessive knee pain, or ankle pain. In that case, it can be avoided. If the woman is overweight, in that case, it can be difficult for her to balance in this posture. So in that case also, it can be avoided. Otherwise, this is actually a very good posture to be practiced in the second and the third trimester, especially nearing the delivery time. This asana can help you engage the baby in the right position. It can help relieving any excessive gas from the body, so hence helping with the constipation. It opens the pelvic area. It at the same time stretches the hamstring muscles, calf muscles, and gives a good stretch to the spine as well. And in when we come out of the posture, we're giving a good stretch. We also stretch our neck and the shoulders and the upper back at the same time. So this asana actually has many benefits, but only should be practiced in the conditions where there are no complications in the pregnancy. Otherwise, this is a very good posture. Now, there are few variations which needs to be taken care while practicing this asana and adjusted according to the body and the comfort of each woman. So that needs to be taken care. Now, in the full squatting, sometimes the heels can lift off the floor. In that case, either while practicing this asana, one can roll the mat and keep underneath the heels, or take a slight cushion and keep underneath the heels if required. And if required, you can also ask them to take support of the wall to not to fall down, or just retain the balance in this posture. Other slight thing is, we are going to tuck our fingers underneath our feet in this asana, and in that case it can be difficult for some women to lengthen their complete legs while being in this asana, and hence either they can bend their knees a bit if required, or hold wherever is comfortable to them. Now I'll show you what we are intending to do in this one. So we slightly place and create a gap in between our thighs, being mindful of the baby and the belly, and no compression at any point in time, no jerking, complete inhalation and exhalation during while being even in the asana. Being mindful with the breath while practicing is a very necessary part of this asana. Now, coming into full squat and placing your fingers underneath one feet and another feet. Once you have come into this, we are going to straighten our legs. And now here, we can hold wherever we want and then straighten our legs. If we can't straighten our legs while our fingers are underneath our feet, in that case, we can hold wherever is comfortable. And we don't have to straighten our legs just while keeping the fingers underneath the feet. So, holding here, so we inhale. And as we exhale, we straighten our leg. Inhale, look up. Exhale. Inhale. Exhale. And release gently. We can practice this for a couple of times, but keeping in mind not to compress the belly at any time, not to overdo it, causing any dizziness or breathlessness or restlessness in the body. So being mindful of that. Otherwise, this asana is absolutely good. This can also help relieve any lower body tension, fluid retention, leg cramps at the same time. So this is very good asana for many conditions and can help prevent many complications for the pregnancy, but at the same time there are many preconditions or complications in which this should be avoided. Thank you.